Welcome to Patient Assistance Tool, the web-based version. This is the basic introduction. PAT is a separate program to best practice and is used with this program. It's a web-based program. It obtains patient demographics, active diagnoses and results from best practice. Windows 10 makes it easy to have PAT on one half of your screen and best practice on the other. If you wish to use full screen, you can Alt-Tab between the full PAT screen and best practice. At the end, PAT sends the care plan and the GP/MP into best practices enhanced primary care section. One logs on each day with a 6-digit code obtained via your smartphone. The general GP/MP is the core GP/MP clinic. Every clinic includes a core of adherence, absolute risk calculation, sleep apnea screen, a quick depression and anxiety screen, quick screens for dementia, falls, home assistance, a question about advanced health directives, and a quick screen for osteoporosis and chronic kidney disease. As well, all the recommended age-specific preventative health programs are included, for example, bowel screen, recommended immunisations, for example, pneumovax, and a screen via wizards for smoking, nutrition, alcohol and physical activity. In addition, based on the extraction from best practice of the Acton problem list, subclinics are added. They're automatically matched to the active problem list and added to the core. They can be added more or can be deleted. I'll show you on the next screen. Each of the 30 common chronic conditions are available as a subclinic. This is what the screen looks like. You can see that on this side you have active problems on this side of the subclinics that have been added, and on here you have the ability to add extra subclinics or to delete clinics if you wish. There are 3 cycles of care available in PAT as well: asthma, diabetes and COPD, age 75 and 45 assessments, and chronic pain GP/MP. PAT is normally a 3-stage process. There's a nurse checklist for some basic tasks. This takes 15 minutes. If you wish your nurse to do an ECG and an ABI, obviously that time adds on. Patient section can be done in 3 ways. It takes about 15 minutes. The nurse can read the questions to the patient. This is the slowest. Patient can read the nurse's screen and the nurse can clarify any questions as needed. Or the quickest one is a patient using any touchscreen tablet in the waiting room. The staff section is very simple. It's just a series of questions for the doctors. It's yes, no or not applicable. Once a problem is identified, PAT offers Google Chrome speech recognition to reduce typing to a minimum. At the end, the GP/MP and TCA is automatically generated and exported to best practice. Typical, this is stage 1, nurse checklist, very simple list of tasks. PAT's rating room then shows the progression. This patient has finished the patient section, finished the staff checklist, and so is ready for the doctor. This is one of the wizards. This is the smoking wizard. If the patient said yes, they are a smoker, this is one screen from the smoking wizard. And each of the wizards for smoking, nutrition, alcohol and physical activity asks the patient to nominate their stage of change before they see you. This is a typical patient screen. Their screens are yes, no or not sure. So they get a bite of information. This one tells them about average tone blood pressure readings, asks them do they own a blood pressure monitor. Here is a typical doctor staff screen. Once again, fairly simple screen. The blood pressure has been recorded by the nurse and appears in your screen. All you have to decide is whether you want to alter blood pressure treatment or not. To avoid cluttering the screen, we have summarized. There's a quick summary of the blood pressure targets. This is a very simple summary, or you can use the full National Heart Foundation guideline summary. So this is the short summary if you click that icon, and you also have the full reference if you wish it. This enables you to keep up to date with all your guidelines. If you answer yes, in this case we decide to treat the blood pressure, What we have here is we have the problem, blood pressure outside range. We have the goal, which is to reduce the blood pressure to less than 135. We now have the editable one here. All you have to do is click here and you can use speech recognition to dictate what you wish. Over here, you then decide who's going to be responsible for the problem and the time scale. So we see that side screen. Over here, it's magnified. It changes color depending. So action planned in this case. In other words, we haven't started treatment, but we plan to do it. The GP is going to do it, and they're going to do it in about 7 days' time. Next, question about their foot. If they have abnormal foot structure, once again you have the issue, the goal, and you decide using Google's speech recognition that you're going to send them for podiatry referral. If you click over here, you can change it to referral. Then if you type in PO, it'll list the podiatrists, and what will drop down automatically will be all the podiatrists you have in your own list of podiatrists in your software. And then right at the end of the GPMP, where the TCA is being generated, your podiatrist which you have selected and named in the program, all you have to do is just decide you're going to give the podiatrist 3 visits and the physiotherapy 2 visits, and that then completes your EPC. The next screen basically is to satisfy Medicare requirements. Copy of GPMP, you tick yes. Consent, tick yes. Referral forms, tick yes. Referral date, you complete the date that you want. Then it's important to remember that all the questions are saved by Pat, so you can do self-audit, you can do research, or if Medicare audits you and wishes to know if you've been thorough, you can show them all the questions that you've answered. At the end, there's just a one-click step for the GPMP and TCA to go into best practice. So what we have here is the next step. You just print here, and that prints the GPMP, and then you'll get off of the save button, which you click save. It goes directly into BP. And on the right here, if you click for the podiatrist, it will just save a copy of the team care arrangement, print out the EPC form, and that will then be saved, and you can just go to your letter writing section in your best practice software, drop it into your standard referral letter, and send it by your normal referral mechanisms such as medical objects. So thank you for listening to the basic program.